I caught up with Health Minister Greg Hunt in Queensland today and started by asking what this Adam BANDT speech told us about the risk to national security from a Labor Greens government.
What we're seeing is the unravelling of the future under Anthony Albanese. We've already seen they can't manage the economy. They wouldn't be able to manage security, and I say that with a heavy heart. The party of Bob Hawke is not the party of Anthony Albanese. They would have to be beholden to the Greens to form government, either in the House of Representatives or definitively in the Senate. And you have a Greens party which is resolutely critical of the alliance with the United States, which is against the AUKUS arrangements and which is against Australia having sufficient capability through our future submarines program to defend Australia. A complex security environment, the need to have a clear plan, which we do have, but then on the other side we have a Labor Party which would be in government with the Greens. They can't manage the economy, and now we know they wouldn't be able to manage our national security.
Yeah, that national security angle, especially with the pressure from the Greens, is a real worry. Let's get back onto your area and health, and a major announcement from Anthony Albanese today about Medicare centres around the country where people could go and get instant medical help, bulk billed to ease pressure on hospital emergency departments. It sounds very much like the GP super clinics we got from Kevin Rudd back in the day.
Well, it is the GP super clinics, but with a quarter of the funding, and that policy failed. They built half of what they said they would. They couldn't deliver the opening hours. They couldn't deliver the bulk billing rates. We've had to rehabilitate Medicare. We've introduced telehealth with 100 million consultations, telehealth made permanent and universal. But this is a half-baked policy which the AMA has declared to be incoherent policy today, which they denounced as a failure at the time, and which the Auditor General found to have catastrophic flaws in it. So, worst of all though, it would put at risk people's own family general practices, and I don't think that they have any idea what they're doing. And it was clear with economics, it's clear with national security, but I have to say I think that Anthony Albanese is even worse at health than he is at economics. Now that's a contested statement as to which he's worse at, but it's not looking that he's up to the job.
Well, we shall see, but the idea of stopping people just turning up at hospital emergency departments to get free medical care and immediate medical care when it's not that serious is the right aim, isn't it? Is this not a way, some way to try and help this happen? Or is there any evidence that the telehealth you've talked about, which is now permanent, which has changed life for a lot of people during the pandemic, is that alleviating that emergency department problem in any way?
Well, there are 8,000 general practices around Australia, and this is some sort of half-baked plan to support 50 super clinics, and the numbers don't stack up when there are 8,000. But most importantly, it's about supporting every practice, as Dr. Chris Moy, the Vice President of the AMA, said today. That's exactly what we said this morning when we saw the sort of flimsy few lines of policy. I can't believe they've had 3 years and this is what they've produced. They've gone back to the biggest health failure under Kevin Rudd, other than stopping the medicines. Stopping the medicines was the worst of the worst, but the super clinics are a byword for health policy failure. But most importantly for people, what really matters, 100 million telehealth consultations made permanent, and where I was today, Bribey doctors on Bribey Island with Terry Young, our member for Longman, they have a working emergency clinic. They are treating people, and they're doing it because they have funding under Medicare to support their work. We've gone from $19 billion, we're going towards $36 billion of funding, and that is real medical support making a real difference, not a retreat to Kevin Rudd's worst excesses.
Greg Hunt, you'll be Health Minister till election day, then you'll sail off into your second or third career, and good luck with that. But who will be the replacement Health Minister if the government's re-elected? Do you have any suggestions to make?
Look, obviously the Prime Minister will make an announcement within the coming week, well before I think we know, even if we ever know before the election, who Labor's Defence Minister, even more important after the Greens' comments today, and Home Affairs Minister will be, even more important after the Greens' comments today. So I'm very confident that there is an outstanding successor, and you'll hear from the PM within the coming days. Significantly, it might be valuable if Mr Albanese, after Adam Bandt's intervention today, could let us know who the Defence and Home Affairs Ministers will be under him.
Indeed. Thanks so much for joining us, Greg.
Take care, Chris.